Good evening. My name is Renee Detky. I have a doctorate in natural health. I'm an educator. I'm much better one-on-one than I am on stage or in front of a camera. Yet this information is important and it needed to be taught to a wider audience as soon as possible. If it helps you, please share it with those you love. COVID-19 has become a global crisis. In this video, I'll explain the importance of prevention, social distancing, strengthening the immune system, and then what to do should you get the virus at home. If we successfully keep one person out of the hospital or help one less person end up on a ventilator, that would be a wonderful accomplishment. This pandemic has united this planet like nothing else in my entire lifetime. No one is invincible. We must work together. If someone told Americans a month ago that we'd all be in lockdown, we would have laughed in their face. The funniest part of this, during Prohibition in the 1920s, liquor was illegal. Now, during the lockdown of 2020, liquor stores are considered an essential business. What makes this a global crisis? Unlike other pandemics, this is the one that can be transmitted without symptoms. This virus causes a collapse in the alveoli, the small sacs deep in the lungs, where CO2 is removed from the blood oxygen and the oxygen is put into the blood. When these collapse, this transfer is diminished. People develop hypoxia, which is low levels of blood oxygen. So when people reach the hospital, even on oxygen, their blood oxygen level remains low. Typically, on day 7 to 9, people begin to spike a fever and start a cough. And around day 12 to 16, from the date of infection, the symptoms will peak. If someone is going to die, this is the time it's most likely to occur. From day 17 to 23, those that will survive begin to get better. They continue to shed the virus in their cough and sputum through day 23 to 30 after the date of infection. From the day of infection, people can spread it to others for up to 30 days. Tuesday, March 30th, it was announced there is hope. This is Dr. Vladimir Zelenko from New York. He's successfully treated nearly 700 COVID-19 patients. He's using hydroxychloroquine, erythromycin, and zinc sulfate. Out of his 699 patients, 0 patients have died, 0 patients have been on ventilators, and only 4 hospitalized. I want everyone to understand the difference. COVID-19 is not the flu. It's not even a bad flu. It's much stronger. It's much more contagious. Where the normal flu, you would spread it to 1, maybe 2 other people. With COVID-19, it is at least double that. Some studies are saying it's 10 times more contagious. The incubation time in the flu is under a week. The incubation time in COVID-19 is up to 14 days. Some people say 28, but the statistics reflect up to 14 days. Hospitalization rate for the flu is about 2% of really vulnerable people. The hospitalization rate for COVID-19 is nearly 20% of people that get it. The fatality rate in the flu is less than 0.1%. The fatality rate with COVID-19 in China was as high as 4.5%. How to prevent COVID-19? The best prevention we have, and the reason that most of the globe is locked down, is social distancing, keeping people 6 feet away. The virus is most commonly spread with people in close contact. Now, we do want to wash our hands. We do want to disinfect surfaces. But the best thing you can do is social distancing. Masks are becoming more and more common. That's fine. It stops the sputum and things that flow out of your nose and your mouth. That is the contagious part. But let me encourage you, wash your hands. Wash them thoroughly. Wash them with hot water. Wash them with soap. Wash in between your fingers. Wash under your fingernails. Wash your palms. Wash up your arms. But wash your hands. Keep hand sanitizer in your car. If you're not near a sink and you get in your car, hand sanitizer. That's between the public and when your car's taking you home. The surface contact, though it may not be the main way of spread virus, there's also evidence that fecal and oral transmission, but having restaurants shut down has greatly helped with that. The main thing with COVID-19 is you don't need to be coughing, you don't need to have symptoms to be contagious. So 25% of cases were from people without symptoms. The incubation period, like I said, they're expecting that it's 14 days. The average is 5. That doesn't mean it's not going to show up at 24 hours later or it's not going to show up at 15 days later. So it has an extended incubation period. Up to 20% of COVID-19 patients may end up in intensive care and require hospitalization for weeks. Flattening the curve is the slowing down of people who get infected at the same time. The reason is we do not have the medical capacity to treat all the severe manifestations of the disease. If everyone gets it at once, there will be more vulnerable people with severe presentations than we have doctors, nurses, beds, or ventilators to keep them alive, in which case many will die. If we all get it at the same time, 80% of the vulnerable population, those who will only survive with intensive medical intervention, will die due to lack of medical resources. If everyone gets it at the same time in about 3 weeks, those who will survive will get better, and those who will not will have died. The downside, however, in flattening the curve, instead of a 3-week ordeal, is that it's going to last for several months, and some estimates even say several years. So I want you to understand this particular graph being my favorite of all the research and helping you to understand why we're staying home, why we're trying to reduce the spread and slow it. We can't stop it. Viruses run their course. But our medical care system can handle this amount. And we are taking it up so that we have more nurses and we have more doctors and we have more hospitals. But slowing it so we don't have a bunch of people up here that need medical care and it not available, this is us being in lockdown. And this may extend out to here. It may go on and it may come back in the fall or it may come back like the flu does each year. But our medical system is a great one and we'll be able to handle it. My clients grow tired of hearing me say, eat more fruits and vegetables. 3 fruits, 6 vegetables every day. These antioxidants inhibit the replicase transcriptase, which is the essential for replication of COVID-19. So yes, eat your fruits and vegetables. Keep your antioxidant stores high. Strengthen your immune system. Optimal functioning of the immune system is vital for defending against all types of infections, from the colds to the flu to life-threatening pneumonia. So a nutrient-dense diet, 3 fruits, 6 vegetables every single day helps with that. Regular exercise. There's a huge amount of research showing that 8 minutes a day is a huge turn in your health and your immune system. Plenty of sleep. 8 hours is optimal. 6 hours a day gets people by. It doesn't strengthen the immune system. You need to get that last 2 hours. Stress management. My favorite being exercise. Whatever winds you down, that's what you should be doing. Specific micronutrients, and we're going to go into a recommendation of those. Dr. Shiva Ayyadurai, a world-renowned systems scientist and pioneer in the field of systems biology, with 4 degrees from MIT, the last being a doctorate in biological engineering, composed a letter to President Trump with offers of a more viable solution. This is step 1 of his plan, to organize citizens into 4 groups. And you're welcome to pause your YouTube video and decide which group you belong in. Group 1 is people testing positive for COVID-19. Group 2 is people hospitalized in critical condition. I doubt they're watching this video. Group 3 is immunocompromised or people over 65 not positive with COVID-19. And then group 4 is healthy individuals that are not positive with COVID-19. Step 2 of Dr. Shiva's plan is to deliver a personalized protocol for each group. Quarantine them, of course. give them 400,000 international units of vitamin A palmitate for 2 days out of the month, and 50,000 international units of vitamin D those days also. Group 2, being in the hospital, same protocol, but they would be receiving intravenous vitamin C. Group 3, these are the group of people with immunocompromised systems, over 65 years old, diabetics, people with high blood pressure. And this group would do 400 international units of vitamin A for those 2 days, and then 50,000 international units of vitamin D those 2 days. His protocol was 1,000 milligrams of vitamin C. I have added that as much vitamin C as your bowels will tolerate. And I've also added in for women 15 milligrams of zinc, and for men 30 milligrams of zinc. Group 4, this is the protocol for healthy individuals. For adults, daily, take 10,000 international units of vitamin A palmitate, 5,000 international units per day of vitamin D, and at least 1,000 milligrams of vitamin C. Again, 15 milligrams of zinc for women, 30 milligrams of zinc for men. And the green highlighted are mine. I'm not going over the children's version, these are adult versions. His step 3 is getting people back to work and maintenance. The people in groups 1 and 2, well, when they regain their health, they would do the following like they did before, including iodine and vitamin C. Symptoms. So the most common symptom of COVID-19 is the fever. 90% of people have a fever. That doesn't mean if you don't have a fever that you don't have it. A portion of patients just have diarrhea. World Health Organization advisor published a mild case of COVID-19 is nothing compared to a cold. Don't mistake a cold. Severe cases require supplemental oxygen, sometimes via a breathing tube and a ventilator. Critical cases involve respiratory failure or organ failure. This is a chart showing all the different symptoms that you can have when you get COVID-19. And as you go through and you're wondering, do I have this, do I have this, do I have this? Remember, a runny nose is rarely part of COVID-19. So that you can say, it was my allergies. If you have symptoms, what should you do? Call your doctor. If you are older and you have underlying medical conditions, it's even more important to call your doctor, even if you only have mild symptoms. Before you go to the doctor, call ahead. Tell them you're coming, tell them what you suspect so they can protect their medical staff. The CDC recently committed to covering the test cost. In Jacksonville, we have 2 different stations. Some require a doctor's note beforehand. Some of them you can show up when you have symptoms. And this is changing day to day, location by location. Self-isolate, including staying away from everyone you live with if you think you have COVID-19. The World Health Organization found the most of the transmission in China were between family members. Self-care. The COVID-19 is very similar to other respiratory infections. Drink lots of fluids. With COVID-19, I recommend drinking hot fluids. Coffee, tea, soups, sipping something hot every 15 minutes. COVID-19 virus dies at 133 degrees. That's without your immune system fighting. So if you catch it in your throat and you get something down there that's 133 degrees, then you can kill it. The main thing is to prevent it from going into your lungs. Avoid taking ibuprofen. There's too much research out there already saying that it is bad for the lungs with this particular disease. Tylenol is what is considered safest. Gargle with some kind of antiseptic, whatever you prefer, lemon water, salt water, vinegar water, Listerine, but on the hour, gargle with an antiseptic. Kill as many of these viral germs as you possibly can. And you need to self-isolate for 14 days. So the protocol for group 1, I want you to add the melatonin and add the high-dose vitamin C. Oh, if you're in group 1, do that protocol. And add melatonin and vitamin C. Self-care. I want you to understand the difference between social distancing and self-isolation. It depends on if you actually are sick and definitely exposed, or you're simply being cautious. If you know you could be shedding the virus because of symptoms or exposure, you should be self-isolating alone in your bedroom. Hopefully you will have someone bring you food and to disinfect the bathroom each time you use it. Social distancing means staying 6 feet away from everyone other than the person you sleep next to. At my house, we live with my parents, both in their late 70s. I am the most likely to contact or be a carrier because I do the household shopping and work in an essential business still outside of the home. To social distance, for their protection, we try to stay 5 to 6 feet apart, unlike we did previously. Previously, we all crammed together at the kitchen table each night. We now eat in the dining room table that's set for 12 people, but there's only 5 or 6 of us, so there's plenty of space. Sometimes we forget, but we're trying for their protection. When should you seek medical treatment? If you get a fever of over 100.5, or if your cough is worsening, when you have shortness of breath, any kind of chest pressure or chest pain, COVID-19 has a habit of going into the heart. If you're unable to hold your breath for 10 seconds, if you have confusion or you see a loved one that has confusion, or their pallor goes gray or their lips go blue, anything that reflects lack of oxygen. If you have a pulse oximeter, anything below 90% oxygen in your blood, you should head to the hospital. What makes COVID-19 uniquely damaging and different from other viruses such as influenza is its ability to cause acute respiratory distress syndrome. It happens rapidly, regardless of the age or the underlying comorbidity. After the onset of COVID-19, patients may start to experience shortness of breath, dyspnea, which leads to acute respiratory distress syndrome very quickly, and that can result in organ failure. In healthy individuals, the immune system processes pathogens with natural immune response that is mild and non-lethal. However, with those that are immune compromised, elderly, and those with pre-existing conditions such as diabetes or high blood pressure, their own immune system may overreact, and in that case of COVID-19, attacking the lung epithelial cells and tissues, leading to hospitalization or mortality. So after you've had it, you can safely discontinue home isolation after your symptoms, your cough and your fever have been gone for 72 hours. And remember, the biggest thing with this is after you feel better, you are still contagious. And those that have mild symptoms and you think you're fine, make sure that 7 days have passed since your symptoms first appeared, at very least. My passion is to empower people with health. I would like for each of you watching this to learn things that strengthen your own immune system. We at Wise Pharmacy, Ortega Medical Arts Building, made this instead of our monthly educational seminar. We did not want to gather as a group and spread the virus even more. Address any further questions to Gil or myself. Please put what you have learned into practice and share this with those you love. This presentation is being made for informational purposes only. I am not a medical doctor. I'm an educator for healthy lifestyle choices. No part of this program is intended to diagnose or treat any disease, illness, or injury. If you show signs of COVID-19, contact your medical provider immediately. Failure to do so may jeopardize your life and the lives of those around you. Thank you.